Okay, recording is on. I hope it's video recording. Actually, how will I know that this is video recording or audio recording? There is just option of recording. Hello, hello, hello. Oh shit. Hello. Okay. Okay. So you mean it's actually video plus audio both when we have an option of recording, right? Yeah, that's good. That's what I want. Thanks. Okay, so I think we'll start it now. This will be our first class. Mm, I know some of you have the basic knowledge of meta-analysis. Uh, like specifically, the first thing. the f- it's 10:07. We will wait for people uh, till for more 3 minutes. See if okay. So let's share. Okay, so you people see my screen. Hello. Okay. Thank you. Thank you. Thank you. Thank you for letting me know. So so let's start. The thing is that the research are of different kind, right? But different kind, I mean, like some are original research. By the original research, I mean, I think I need to specifically stop this exact show. Like specifically, let me show you. Like for example, this is a recent paper I was studying, right? This is a recent paper I was studying. I hope this will be a full text. By this paper, I will help you like what is actually uh, what's actually yeah I have already downloaded it. What's actually like different kind of we have different kind of research, right? So I'm actually explaining to you this. So the first thing is original research. By the original research, I mean like specifically like in your hospital, the hospital you are affiliated with. For example, my college is affiliated with Mardan Medical Complex. So in this hospital, they are conducting different professors and in a specific department, like for a cardiology department, like a pulmonology, psychology, any of the department. They are trying to do a research on a specific topic. So they collecting data of the patient that they have seen in their in their department, right? So that will be the original research because they will use the data of the patient which they attend, right? So that's called original research, right? The one today, which is the topic of discussion, the systematic review and the meta-analysis, as the name specifically, it's saying review. What mean by review is, see, I think there's one person. Okay, so saying about the original research. So the topic which we are discussing is like the what's called it's called the systematic review specifically means that you are reviewing the whole scientific literature about a specific topic you are interested in. So uh, uh, that's why I'm saying to you that we will do a review. So as you are doing a review about a specific topic, so the first important point is that you should have interest in that specific topic. Without interest, sorry, let me see how it is. And much focused. Okay, so I was saying that at least you should be interested in that specific topic. This is really important because doing research in a field that you are not you're not interested is okay as far as you are trying to learn things. But once you learn things, then your interest should be the priority. This should be the priority. And I promise you will find people with whom you will connect it. Like for example, this is just about my recent one. Like I'm at this stage still want to connect with people. Not all. I'm specific at this stage. I'm writing letters. I mean, email to the persons in which research I'm interested in. Like specifically this. This is Dr. Peter Nana. I even don't. I know this that this specifically the first. I don't know whether the person was uh, even it was a male or female, but it doesn't matter for me. So I email them that, hey, doctor, I searched their Google Scholar. I read actually I read their different papers, and I really like their papers. So that is the why I interested. Uh, mm, I email her that, hey doctor, uh, I'm interested in the top in the field you are working in, and I'm really like I really like the way you are doing systematic reviews and the topic. Right. So this is that specific like vascular surgeon, like actually she's a female, but I like at systematic review. So that is the reason I email her, and I said to him, I like your papers and I want to work with you. Right. So the thing is that she is actually doing both. She is actually I specifically want to know her Google Scholar so that I show you what's mean by original research and what's mean by uh, sorry and what's mean by systematic review, and who you can message so that they help you in the projects, like specifically at the level of the student. Maybe you do not have that much clinical knowledge to develop a really clinically relevant question, right? Like for example, if you see this, she have published great systematic review and meta-analysis. Even that's editor choice, right? So again, if you see more, so my whole topic of discussion is you should do systematic review and meta-analysis. Once you learn it in your field of interest, connect with the people in your field of interest. Maybe you have rejection. If you see this, if you see this, I first email her, then I share the projects, right? Then after 6 days, I send another reminder to her that I'm waiting for your response, right? After that, she reply me. So I know you will have rejection, but it's okay. It's okay. she said to me that she is nowadays working on original research, doing primary observational studies. So uh, like she is doing observational study and not nowadays doing any systematic review and meta-analysis. That's okay for me. At least she responds that that's okay for me. So this is the way you will connect with the with people who are in your field and you are interested, right? So uh, that's what I want to say to you, like uncome from and have it matter. Okay, so this is one thing. Second thing is, like, specifically if you now maybe you question me like, Asad, why to do meta-analysis if you are saying that original research is this, meta-analysis is this, like why to do that? So let me give that reason. So specifically, like, for the original research you need your hospital help, you need your hospital help, and specifically in the and in sharing data. Right, right, like specifically if now in this case I ask this person, this patron Nana, and I said to him that, doctor, I'm interested to work in your paper, I'm interested to work in your paper, but that's actually a primary paper. I mean, that not a review, that not a systematic review, not a meta-analysis. Obviously, she will say to me that, Asad, I can't share the original data with you because the the data which belong to a specific hospital can shared only with the people who are employed in this hospital. So even if I say to her that, oh doctor, even if you don't offer me an authorship, still I want to work with you so that I learn research from you and the original studies. Still she is not able to help me. She is not able to help me. So this is the barrier that the original research you will be working in depend on your hospital. Depend on what? Depend on your hospital. Like in this specific data, she have used like the original data of 198 patient, but this data is like, if you see that, if you read here in the method section, like you have to a specific consent form, and you have to IRB approval. So these things are necessary for the original data, and only the affiliated hospital you are working with can grant access to the data, right? So this is the first barrier in the original research, that only you will dependent on your hospital, right? You will specifically dependent on the department you are working in. So maybe if the department you are working in having enough expertise and doing great papers, then it is good. You can talk to the doctor, the department HOD, that, sir, I'm really interested in working with you. Then this is the case that they will help you. But this is not the case every time. Like, we belongs to a very heterogeneous group. We belongs to very different kind of hospitals. So maybe some hospital grant access to you, maybe they help you and teach a specific statistical method for doing analysis, or for doing a different kind of research in your field of interest. But this is not the case and every time. So here comes systematic review and meta-analysis. This is not limited to only a specific I mean, this is not limited to a specific geography. You can work with people even who's belong to different category. Like, for example, I'm showing this specific topic to you where I work. Yeah, this is it. Here, if you see, there's a different kind of people, like from different, like Aaron is from Italy, right? And there's the another Mustafa is from Germany, and Risa Italy, Alexandra Italy, Rafael Brazil, and this author is from Rwanda, and this from Uruguay. I don't know how to spell it correctly, but this is senior author. So the thing is that in systematic review and meta-analysis, you can even work with people who even you do not know. But once you have that skill and you decided a specific field of your interest, there are a lot of opportunities you will have. Right now, I'm not showing my WhatsApp, but I have 4 topics to work on, right? And I have 3 more topics I was invited in, and 2 topics in vascular surgery where this Dr. Dario said to me that, Asad, can you please check the viability of those papers? And I said that, Doctor, I have some commitment this week, so I'm not able to check the viability. So what I'm saying to you is, this type of research, a systematic review and meta-analysis, that's having least amount of barrier for the student who really want to learn research, publish impactful paper, irrespective, regardless of what environment he is in, regardless of it. It doesn't matter whether your HOD is cooperative enough or not, whether your librarian or statistician have enough resources or not, right? See, so I was talking about this. So this is one important that you will like you will you can avoid in systematic review and meta-analysis. So this is one advantage. The second advantage is about evidence. If you see the evidence pyramid, right? Evidence pyramid, you will notice that systematic review and meta-analysis are like, for example, you are claiming something that this specific drug can do well than drug B, drug A do well than drug B, and treating a specific kind of patient population, right? You are claiming drug A better than drug B. But maybe you are claiming this because of you are an expert, you're an HOD and you are a PhD in a specific field. You're claiming this because of this, right? Maybe you have some case series, a paper. Maybe you have a case control study or any cohort studies. Maybe you are claiming that drug A work better than drug B because you have a specific like specifically show. Let me show this. Like here, they are comparing hybrid versus Norwood procedure in patient with fountain circulation. Obviously, either they will say hybrid good than Norwood. Maybe they show that both are equal, but what they are saying, they will be saying just on the basis of this specific patient population, which are limited to this population. Like, so I don't know whatever conclusion they will be conclude, right? What will be their conclusion? I don't know. I haven't read it, but they will be concluded on the basis of these patients because they did the whole research on 2 to 8 patients. They will be claiming something on the basis of this, right? On the basis of this. So, but what about systematic review and meta-analysis? Systematic review and meta-analysis are not limited to a specific paper. Here, if you see 27 studies, one specific study saying this drug A worked good, second saying both equal, third saying B worked good. So, like, there are different, so in different population, you will have different type of conclusion. So that is the reason meta-analysis is more important in evidence pyramid. If you are saying that drug A worked good than B in a specific population of patient, then and someone said that, what is your reference? What's the source you are saying? So you will say that a specific meta-analysis said that, reported this a drug A worked good than B in a specific population. Then your source, then your reference is really good. When it's well conducted, a well-conducted systematic review and meta-analysis evidence is far more superior than a PhD opinion or a specific cohort or RCT. Right. So this is the reason that if you are doing a systematic review and a meta-analysis on a specific topic, that you will have a knowledge a lot of knowledge about that topic, right? So that is why I'm saying to you that learn these steps. Once you learn it, you will you will have a lot of opportunities. I promise you will have a lot of opportunities, and you will even bore of it. Yeah, a time will come, you will say that, oh, I can't do this, like it's this project, I have a lot of study, or it's not worth my time, or whatever the reason, but you will bore of it. Yeah, I promise you will have a lot of opportunities. But the thing is, the first step is you should learn, right? You should learn these steps. So up till here, I conclude that why you can do a meta-analysis, and as a student, what will the barriers you will face in the original studies, right? So let me see the uh, so now I'll start my presentation, and I'll see that what I mess or not. So up till now, I show you like why to do meta-analysis, why it is important, and why you should do it in your field of interest, and how you can connect with the people in the field of interest. First thing first, like specifically, don't fear that if a specific I ask a specific PhD on LinkedIn on X that has I want to do a research with you, but at least you should know the basics. At least you two should know the work, so that if they take you in your research project and you are able to do things right. So what's this? How can I hide this? Don't know. I don't know how can I hide this. Okay, so put that's easy. That's what I already explained. Okay, yeah. Why unusual studies are not enough? That's what I was talking about. Like the paper I shown you, they were claiming something on the basis of 228 patient. But if I'm doing a systematic review and meta-analysis, I will combine papers on that specific topic from Italy, from Brazil, from China, from US, from Russia, and after that I will combine the whole result. So don't you think that result will be more good than a specific population run in a specific setting or hospital? Yeah, conflicting results. And visual studies sometimes conflict result. Why? Because maybe some procedure in Russia have done better, or their uh, their surgeons having more experience, or their center is a high volume center, or whatever the reason, but maybe the conflicting results. So you can't trust an individual study, but you can trust a well conducted systematic review and meta analysis on the evidence base. It's the top evidence base, right? So that's why systematic review and meta analysis is good thing. Bias and flaws, yeah, in different population, yeah, obviously Australia and Japan may not be applied to the patient in Pakistan or Brazil, but in a systematic review you will have different kind of patient from all over the world, and that result will be generalizable. That's not limited to Pakistan, that's not limited to Brazil, not Japan. That will be applicable on whole world specific population, right? Yeah, evidence research. Okay, so here the next thing is, I hope you all are listening to me. The next thing is research question, like how you can come up with a specific research question. So let me end the show. Okay, show. Uh, yeah. This is you can see this is a WhatsApp image sent by one of my senior and said to me that, Asad, can you please check the viability of this, check the viability of this specific topic, right? So what's mean by checking viability of a specific topic? So this is a specific topic, this is a specific study he sent me, right? So what's this study about? The study is association between operating time and post-operative outcomes and complex aortic endografting. So, and complex aortic surgery, this is actually endovascular surgery, right? And the this paper is actually like evaluating operating time and post-operative outcomes. If in a specific patient, operating time is more, well, their post-operative outcomes means their mortality, their morbidity. Morbidity means the incidence of stroke, incidence of stunt graft failure, technical success, right? So, how will the post-operative outcomes be? How will it be if the operative time of the patient is less, if it is intermediate, or if it is more? So, actually, as operative timing like does as associated with post-operative outcomes, does because of high operative time the mortality is increased or morbidity is increased, or it's the post-operative outcomes does not depend on the operative outcome. Irrespective of the operative outcome, maybe operative time less, more, intermediate, it's not matter at all. So in this paper, they're checking this. So he said to me that, Asad, can you please check its viability? So now I was talking about PICO. PICO means population intervention control outcome, and PICO, it's up to outcome. But you can add TT. T means type of studies and time of follow-up, right? Actually, the study is not, I mean, what you can do is you can, no. So let me check. Uh, what happened, man? I think I've shared screen. Are people able to see my screen? Okay. Okay. So today I want to it's this thing. Okay. It's happening. Let me stop share. Oh my god. I don't know what is happening. Yeah, Hannes, Vicky, you raise your hand. Is there anything you say? Oh, let me close it. But that's so bad. Actually. It's happening. Uh, let me first stop recording.
असद भाई स्क्रीन रिकॉर्डिंग स्टार्ट करो
Recording already started. Actually, I'm clicking on this, but I don't know. There is an option. It's not visible to me. I don't know what the reason. That's so bad. Okay, what should I do it, yes? Should I do?
असद भाई स्क्रीन रिकॉर्डिंग टैब आता है इस पे विंडो आता है दरमियान में इस पे क्लिक
Oh,
में स्क्रीन शेयर कर सकते हैं
okay. But yeah, there is one person. There is one person. Actually, I think I need to leave the call. Okay. I hope everything is, I think, it's going good. Thank you. Yes. So what I was saying is, are you people able to see my screen? Do you see my screen? Okay.
Yeah, yeah.
So okay. So I was actually saying that if a specific teacher gave you a specific topic then and said to you that can you please check its viability? How will you do that? First, I have opened this picture. Can you please some of click its screenshot and say to me what's the relation between operating time and post-operative outcomes, right? Operating time and post-operative outcomes. Okay. Operating time and post-operative outcomes. So I'm not able to. Uh, so when I'm working in this Google, can you see it? Are you people able to see like I'm writing what in my Google?
Yeah, yeah.
Okay, yeah, that's no, that's right. So yes, yes. So association, association between operative time and post-operative outcome. So actually, this was the paper he sent to me. I have its full text. I will show it to you. But the thing is that how will I check if this paper is viable or if the specific topic is viable or not. So uh, first you need to look for the PICO. What's its population? Maybe some of you don't know like what's population. So population is patient and complex aortic endographic. So all the patients who are doing endovascular aortic repair or endovascular aortic surgery, like aorta have two types of operation. One is open repair when you do median sternotomy, you do open repair, and the other one is endovascular. You do it with a stent to pass in the femoral artery, right? And you do this, and this is called endovascular uh, procedure, right? So the population, what's our population? The population is like in a complex endovascular aortic repair. Whoever the population is, when they are doing complex endovascular aortic repair, and what's our intervention? Our intervention is operating time, right? Operating time, and what we are looking for. And what's our control like specifically if you're saying like what will be our control, so the operating time, if you see this, I have this paper and the full text. Let me. I think yes, it's sent to me. Let me see. I think it's this. Yeah. Do people see my this? I have opened it already. No, no, that's no. Yeah. Yes. Okay. Thank you. So in the method section, the aim of the study is relation between operating time and post-operative outcomes to explore what are the factors contributing to operating time. And after that, in the method section, the operating time was defined as the interval from first arterial success to closure. That's the definition of operating time. It must be noted. 530 patient underwent complex aortic repair, including fenestrated and vascular aortic repair. branch endovascular repair and what's a arch branch endovascular aortic repair. Median is what? There is no significant difference between the groups. Yeah. So when stratified by operation time tertiles, the 30-day mortality rate was statistically significantly higher in the longest tertile compared to the shortest. So the mortality is higher in the longest tertile. Tertile means like 33 33%. Yes. Let me confirm. Let me confirm it. Tertiles. I think it's 33%, but still. Can you tell? Yeah, 33%. So yes. So the thing is that this is the first tertile, this is second tertile, and this is third tertile. So operation time. Operation time means like a specific time. Let me see what's this selected. The median oral. Yeah. So the median oral operation time was this. Clinical outcomes. Yeah. Clinical analyzing according to the patient tertile, each including approximately 1/3 of population. 1 each first, second tertile, this, and among this. So the first tertile median. Yeah. So this is the thing. The first tertile median operation time was 105 minutes. The second tertile time was 152 minutes, and the third tertile operation time was 231 minutes. You can see that the operation time was described like in the there are 100. For example, if there is 100 patient, right? And you divide it at by tertile. So 33 in the first tertile, 33 is in the second tertile, and 33 is in the 33.3 is in the third tertile. So they divide the operation, the population on the basis of their operation time, and they analyzed like how their how the mortality, if you see in the first tertile, the operation time was what? It was 105. In the 105, the operation time and the death is 0. And the second, the death is 3, and the third, the death is 16. So what they conclude is, here is the conclusion in the abstract: in the high volume single center experience, prolonged operation time was independently associated with increased fertility mortality rate after complex endovascular aortic repair. So the thing is that my intervention is high operating time, my comparison at low operating time, less operating time, and my outcome is morbidity and mortality, death, technical success, and whatever the post-operative outcomes are. So do you people understand from this specific study, how I got its population, its intervention, its control, and what are their outcomes are? And now my teacher is saying that, also, can you let me know that as this idea is viable for meta-analysis or not? How will you do that? You need to check their references. That's okay. If you read the whole paper, that's okay. From where I have studied, I learned the meta-analysis. The Meta-Analysis Academy. They teach the method that you need to do. You need to read the introduction. You need to look at the. You need to read the full text paper. But I think I find it good if I just look at their references and see what paper are they referring to. Obviously, the papers they are referring to will be related to this paper, will be related to this topic, right? So let's see. As this paper, meta-analysis of individual paper data, the trial comparing outcome of this. So this is not related to my topic. Endovascular, no. Contemporary comparison of endovascular, no. Penetrated endovascular multi-center experience, comparison of this and this. Open. Increased duration of operation, time for carotid and atherectomy is started with. Yeah, this is something which is published in 2016, but this is related to carotid and atherectomy. Of course, this comes under the category of vascular surgery. Now you can modify your PKT that my population is not aortic endovascular complex endovascular aortic repair. You can expand your population to the vascular surgery. Your population will be as the operating time affect post-operative outcome and endovascular surgery. So now what is your population? So the thing is that you can modify the PKT of your meta-analysis. You can modify the PKT of your meta-analysis. That is in your hand. That is in your hand. You can modify it so that you can get more studies, and or specifically you can narrow it, or you like specifically, as I said to you, that I can maintain my population specifically upon complex endovascular aortic surgery. I can make my population this. Even I can narrow it more. How will I narrow? I'll say that population doing fenestrated endovascular surgery. So EVR. So I can narrow it, the PKT, the population of my meta-analysis, like what the studies will I include in meta-analysis, that's depend on me. I can narrow it, I can expand it. That's depend on me, right? So this is a study which on carotid and atherectomy, and this is specifically a topic which comes under the category of vascular surgery. Again, prolonged operating duration associated with complication, systematic review and meta-analysis. So now you got a specific meta-analysis which is in 2018, and this is 2016. Prolonged operation duration associated with complication. So prolonged operative duration as associated with complication, you need to check it. This specific meta-analysis did not specify a specific population. Like, I mean, they did not like restrict to a specific surgery. Like maybe, I don't know, maybe they have taken aortic surgery, endovascular surgery, or whatever the surgery they are taking. They are just saying that operating time and its effect on complications. More the operating time, more will be the complications, and then they will subgroup studies on their like in their field. Maybe they subgroup the studies of vascular surgery, of aortic surgery, of orthopedic surgery, of whatever surgery the studies are about, and they have subgroup it, right? So you can do this. So again, what I'm saying is, like, you can modify your PKT on the basis of availability of the study. So I need to check this. Shorter duration, more platelet bypass surgery, decrease surgical site infection, and shorter. So this also bypass started with. I will check this, like what specific field is this? Institution, hospital, volume. So this is about volume. Vascular surgery, management of thoracic guidelines, reporting standards, skill mastery, systematic review of upper extremity for fenestrated on this, use of shearable, impact of early pelvic. So the thing is that I just need to check the study 7, 8, and 9, as I think specifically study 7 is more related to the topic. First I need to check the study 7 at 9. So I have already checked it. Let me see. I think this. Yeah, operative time and outcome of complex. This is not that one. Let me see. So, operative time and outcomes of complex endovascular surgery for thoracoabdominal aneurysm. So I searched that, and I said to sir that, sir, I have just these 2 papers on this specific topic, and for meta-analysis, for good meta-analysis, you at least need 4 papers. Meta-analysis can be done with 2 papers. Yeah. What is meta-analysis? Meta-analysis is combined statistically studies. Like one specific study is saying that with the low operation time, they suggest, like, whatever, I think it was 105 minutes. The mortality is 0. The other study is saying with 105 minutes, the mortality is 2. You can statistically add this. You can do, you can add it. Mathematically, you can, statistically, you can do meta-analysis of two studies, but that's need a lot of strength and a lot of good manuscript writing skills to publish it in a good journal. So what I'm saying is to you, for meta-analysis, you at least needs 4 studies, which on your topic, right? So I check this, and it's published in March 2025. So uh, that's one thing, that you need to find the studies about your topic. The second thing, which is also very important, you need to make sure whether on this specific topic, whether a meta-analysis exists or not. How can you do it? You can do it by article matrices. So on this specific topic, there is no specific matrices available because it is relatively a new topic. But for example, yeah, here matrices view detail. For example, let me show it. This is a specific meta-analysis. As I said, we have 27 studies. So we cite those 27 studies. Right. Now, if you open any one of the 27 study, you will see it's cited by this specific meta-analysis. So that is the reason this is a paper, and you want to know whether a meta-analysis exists on this topic or not, you will check its citation, right? Like what type of article cite this paper. So if a meta-analysis exists on this topic, obviously they will cite this paper. And if you check its citation, there is 25 citation. And if you check its citation, you will know whether I have prior already a systematic review and meta-analysis on my topic or not. As I said, you need at least 4 studies on a specific topic to do a meta-analysis. Along with that, there is no prior meta-analysis on this topic, right? So, as I said, this is a specific study. I searched that there are 4 papers on this specific topic. Let's say, I'm giving an example. You check that there are 4 papers on this specific topic. Now you are making sure there isn't any systematic review meta-analysis on this specific topic. What you need to do, you need to check its citation. Like you need to check, like in Pakistan, okay, it's what citation, but this is not. This is just experience from one single center. This is not systematic review. This is not systematic review. Not systematic review. Not systematic review. No, multi-center experience. After this, to this, retrospective cohort study. This narrative review, long-term experience, this systematic review, yeah, systematic review and meta-analysis of cerebrospinal fluid drain related motility, cerebrospinal fluid drain related motility. Let's see what is the topic. Spinal cord ischemia rates and prophylactic spinal drainage and patient with treated. So this is the thing. This paper published in 2023, but a specific meta-analysis cited. You need to check what this meta-analysis have done, right? And how many studies you have on this topic after this meta-analysis. If you can add considerable number of studies to this meta-analysis, you can do updated systematic review and meta-analysis. Yeah, you can do it. But first you need to check this specific meta-analysis. And this is the most easiest way to check, like who cite the specific paper. And a specific already existing meta-analysis on this topic and you don't know, this is the easiest way you can know about it. Page 2. Okay, yeah, we have 20 results, and I think no. I think we have more. So here in this specific topic, in this specific 1 hour, 50 minutes, I explain why to do a meta-analysis, right? Is you will have limited opportunities of doing original research. And furthermore, as an evidence-based pyramid, this is at the topmost position. Second thing, I share my own experience that I approached a specific person and said that, yeah, we can do this, and said, we can do this, but this specific person is interested in original, nowadays doing original studies, not doing any uh, systematic reviews and meta-analysis. So it's okay. I got a response. I got one rejection, and it's okay. There are a lot of the whole world. Like the second thing, I said to you that once you learn the steps, once you learn the whole process, you will have a lot of opportunities. Yeah, and I promise this. You'll have a lot of opportunities once you after that. I said to you what is specifically a meta-analysis as why we need to do it, how it helped the original studies, what's the limitation in the original studies that compel us to do a meta-analysis, what's the limitation in it, small sample size, limited to one specific single center, maybe limited statistical power, right? And after that, I said to you that how you can, like, what will be the population of your how you can extract the data from a specific individual study. How will you select your population, intervention, your control? How you can make population, intervention, control and outcomes of your meta-analysis. How you can narrow it, how you can expand it. That's on you, so that you have the viability. If I'm doing a meta-analysis on operation time, operation time and its effect on complications, post-operative complications, and I'm doing it, and I came to know that a specific meta-analysis and vascular surgery is done on this topic, I will narrow my PKT. I will narrow my population to specific endovascular procedure. I mean, I'll see that as here the operation time depends, affect the post-operative complication or not. After that, I said to you that how you can check for more papers related to a specific topic. How you can check it. You can read the whole paper, that's okay, but the most important thing is you can read its references, and the references you will find the related papers. After this, if you decide that on this topic I have 4 papers and I'm okay to do a meta-analysis, now the second step is you need to check whether a prior meta-analysis exists on this topic or not. How will you check it? You will see at citation. Obviously, maybe like this is a specific another topic. What's this? Yeah, this is exactly April 2026. This is most recent. Obviously, this won't have any. Oh wow, so April 2026 and citation. For citation April 2026. Oh, sometime when you are checking a specific recent study, like the one I discussed with you, maybe they do not have any citation. Maybe they do not have any citation. So you need to check individual studies which are published in 20s, like having some citation, and you need to check those. And you need to check those and see if any specific meta-analysis cite those studies or not. If in their citation there's no meta-analysis, it means, yeah, this data is not used yet in a specific meta-analysis. You can use it in your own if you have viability, right? So time is over for the discussion. This is actually I think I discussed things. Very introductory session. I hope you got it. So now 30 minutes you have for questions. Furthermore, before this, I have certain things to say about our workshop. As this was an introductory session, also, this is just a trial. If anybody of you don't like it in a specific, 1 minute, I will give opportunity, Muhammad Hassan, I will give opportunity to you to ask questions directly. You can ask me. But the thing is, before that, I want to say something to you. Here in this workshop, I will teach you the skill what I have in meta-analysis, what I have published in I said in the poster. You have read it. I will teach you that. I'll teach you how you can, for a system, like for example, this is the topic you want to do a systematic review method, how you can make a search strategy, how you can search for PubMed, right? After that, how you can do your screening, how you can extract data. After that, how you can do your analysis. So these are the things I will teach you: single arm meta-analysis, binary comparative meta-analysis, and network meta-analysis, both frequent test and Bayesian framework. So, so if you have anybody don't like it, so you people are open to leave. I mean, your payment will be refunded. That's not the thing, right? Your payment will be refunded. The second thing is, I don't guarantee any publication. This is not a mentorship program. Like, I mean, you have a specific project you're working in, and okay, one time, second time, I will help you out in your extractions. But this is just a workshop. Here at the end of the workshop, if you have any questions, I will help you out. Right? But remember, here publication is not guaranteed, and here we don't have any mentorship session. We will have a class on Saturday and Sunday, each 1 hour, and I'll explain things to you. I will record it, and you will have recording. Right? So yes, you can ask your question one by one. By the way, this was my first workshop I have.
हाँ असद
Yes.
असद आपने कहा कि हम साइटेशन से पता लगा सकते हैं कि इस स्टडी पर आपने कोई लिंक बताया लेकिन मुझे उसकी समझ नहीं आई। आपने कहा कि
Okay.
इसकी साइटेशंस हम देखेंगे और आपने वो कुछ जो भी बताया लेकिन मुझे उसकी कुछ समझ नहीं आई। तो अगर आप दोबारा
सही
उसको रिपीट कर दें।
सही मैंने ये बताया, I said this specific study, this is the topic you are interested in doing a meta-analysis, right? You have 4 studies which are published recently or whatever the time frame it's published in, and you are interested in that I am doing a meta-analysis of out of these 4 studies. But this is not the condition for meta-analysis. Meta-analysis have another condition too. Its condition is you have 4 studies, and along with it, it does not have any prior meta-analysis. If there is already a meta-analysis in the literature, why you are doing it again? So how you need to check at a specific meta-analysis? There are 2 ways. I have just teach you one way, and the easiest way. And the easiest way is to check this specific article matrices. Here it's citation. Okay, this charge is, I think, so less. Let me know when you can't hear this. So in the article matrices, you will have the citation. You need to click on this article matrices and the details. You need to check it. Like when you check it, you will have the specific page. This is 25 citations. You need to click on the Scopus. Here you will have all the 20 or whatever the citation is. You will see this, and you will know that as this specific study is used, the data of this specific study is used or not by a prior meta-analysis or not, right? So if a specific meta-analysis you have noticed on this specific topic, then what you need to do is you need to read this specific meta-analysis. You need to read this specific meta-analysis and think about it, whether you can update it with enough studies you have or not. If you have enough studies, which is published after this 2024, and you can think that you can update it in a good way, then okay, you can proceed with your own meta-analysis. But if not, then your idea is not viable. So this is the way you can search for viability of idea. You have enough studies for meta-analysis, and there is no prior meta-analysis on your topic. This is the way you can check viability of a specific topic.
Okay, thank you very much. I got it. Okay,
No
thank you.
problem. So anyone have any questions? So yeah, I'm open to it. Thank you, Abdul Basit. So I hope you people don't have any questions. Yes,
Asad,
Abhay.
I have an Asad,
Yes.
I have another question as well. Asad, for yeah, before starting meta-analysis, which type
Yes.
of tools are good and which are the standard tools which are free as well? Um, Tell me about that, and also tell me like the search engines for different researches like PubMed and others, which are good and have much data, and we can't miss any research while searching and those search engines. Tell about
Okay, that's a good question, Taraman. The thing is that I will teach you and attend further classes, because we will have a topic of uh, making a search strategy and extracting, I mean, importing data from different databases, from PubMed, from Embase, and from Cochrane, sometimes Scopus. We, we, we will have a class. I think the next class will be on this, making a search strategy for your topic of meta-analysis, and after that, importing references from different databases. Okay, so you obey. Yes, you can.
Hello, Asad. Thank you so much for this section. I have a question or kind of clarification regarding
Yes,
forest plots. If somebody
forest plots.
wants to collect data for forest plots and you want to use only hazard ratio,
Okay,
would there be need for you to also collect the p-values, or do you think the p-values won't be needed for the forest plot? Let's assume I want to do a forest plot of just hazard ratios. Do I still need to collect the p-values, or why collecting the data, or I should just collect just the hazard ratio?
so your question is, you have a forest plot having hazard ratio, right?
Yes, but no p-values. So do you think I can do a forest plot with just the hazard ratio?
Okay, so what I got from your question is, you are doing a meta-analysis of hazard ratio. One study giving a hazard ratio of 2 point what something confidence interval this and to this. A second study hazard ratio from confidence interval this to this. Third study having has a specific hazard ratio and confidence interval from this to this. And you are pooling the hazard ratio, a meta-analysis of hazard ratios. Am I right?
Yes, but those studies didn't give the p-values. Do you think I can
That's
still?
no problem. That's no problem. It's no problem. For meta-analysis of effect size, the one you are talking about, hazard ratios, risk ratio, or ratio, p-value is not needed.
Oh, okay. Okay.
What you need, study name. I'm saying the Excel sheet. I'm saying in the form of the form of Excel sheet. First column will be of studies. Second column will be of HR, hazard ratio. Whatever it is, if it's risk ratio, if it's odds ratio, no problem. Hazard ratio. The third column will be of lower confidence interval. The fourth column will be of higher confidence interval, and the fifth column, if you have any subgroups, if you have any meta regression column for edge, or for whatever moderator you have, that's what needed. P-value is not needed.
Oh, okay. Thank you so much. I appreciate it.
No problem. Next question, please. That's really good talking to you and presenting my first workshop. Consider question from chart. Okay, yes. We have this chart. Here is chart. Yeah, this is chart. Okay, consider my question. Where is your question? Till Muhammad has name. His name. Consider my question from chart. Okay, it's yeah, okay. If there are, let's say, 7-8 articles on a topic and a meta-analysis was done on it. Okay. Now, if there are, let's say, 2 articles more published, okay, can we do a meta-analysis again on that topic? Well, that's nice. Hazrat, do you offer any mentorship program recently? No. Hazrat, I don't offer any mentorship program recently. I mean, and nowadays, but I will think about it and will let you know. Hazrat. Okay, so Hasnan, related to your question, I also have a specific. Where is there is recently a specific. Yeah, there is specifically there is a meta. This is the meta. Left. Do people see my screen? Let me know. Let me see. Do people see my screen? I've opened a meta. Do you people able to see my screen?
No.
Oh, okay. Let me share. Yeah. So this is a specific meta, right? This is a meta. It's published in 2025, right? But recently we have 2 more articles on this paper, right? We have 2 more articles, and you know what? By the edition of these are all for randomized trial, just for randomized trial, and this is published in a Heart Rhythm and a well-respected electrophysiology journal, right? Well-respected journal. Impact factor, I think 6, having 4 randomized trial. Now we have 2 trials more on this topic, right? What they are comparing is an non-valvular arterial fibrillation. Arterial fibrillation means specifically non-valvular arterial fibrillation. Actually, when the heart is in its sinus rhythm, it is normal. When it is out of it, then we call there are different kind of sinus rhythm abnormality. One of it is atrial fibrillation. So in the treatment of stroke prevention of atrial fibrillation, there is a specifically left atrial. In the left atrial, there is a specifically pouch, which specifically sometimes called as the origin of atrial fibrillation. So they are saying this left atrial appendage closure versus oral anticoagulation. Which one is good? They did a meta-analysis in it for different outcomes. They have just 4 papers. I check this, I read this, and now we have more studies on this specific topic. Let me see which one. I think we have. Let me see which one they have. They have Prevail, Protect, Prog option. Prevail, Protect. So Champion. This is a new trial on this is specific and Champion, Prog, Protect, Closure F, and Closure F. These are the 2 new specific RCTs on this specific topic. So we have 2 ways. What way? I discussed it with with a senior author. One of the senior author, he is from the Texas University, Dr. Omar Abdul Fateh. Maybe some of you know, some not. I discussed this project with him. He said to me that Asad, the author of those trials, along with the 4 and the new 2 trials, the author of these trials doing true IPD at the Columbia University. What mean by it? They are collecting the individual patient data and doing a meta-analysis of its own. And that will be more valuable. And by the time we are completing this meta-analysis, along the 4 trials, we are adding the 2 more. We will have the true IPD will be published, and our meta-analysis will not be that much worth it. So he said to me that Asad, it's good not to involve in it. So I think that it's personal choices. It's dependent on you whether you can do it in a short period of time and publish it before the true IPD, which are nowadays at Columbia University on this specific topic. And I'm sure by the addition of the true meta-analysis, a result will be changed. Yes, yeah, the result will be changed. And specifically, these two out of these four papers, two of which use vitamin K antagonist, and the other two used dual anti direct oral anticoagulant. And here they also said that further trials should more focus on further trial should more focus on uh, dual oral anticoagulants compared to vitamin K antagonists. So, and the important and also the interesting point is the two trials which are newly published, they are on dual oral anticoagulants. So the thing is that you can do a meta-analysis of left atrial appendage closure versus dual oral anticoagulant. You can combine like the dual anticoagulant studies, or you can combine the sex and do the sex trials and do a meta-analysis of your own. If you can do it, I mean, in a, before the true IPD is published. But I'm betting for something else because on this topic, another trial, maybe hopefully by the end of this year, will be published, and I'm betting for that. Yeah. Uh, so this is it. The thing is that the idea is yours, whether you want to do a meta-analysis on it or not. But in this case, this is a doable. This is a doable meta-analysis, but I'm not doing it is because uh, actually I want to do. If I'm putting my energies, if I'm putting my time in a project, this must be worth it. Yeah, yeah. If it is not worth it, if a good journal, if a respectable journal is, I mean, it's not okay with my work, so then I usually hesitate. So the thing is that you are saying if you have 7 articles and publish meta in two more articles, specifically you need to look how much population in those two articles, whether this those two articles having the same conclusion in the meta-analysis or a different conclusion for the from the previous meta-analysis. The previous meta-analysis is saying that drug A is good, but the new two article is saying drug B is good. Then yeah, sure, you can go for you should go for meta-analysis. But if that's not the case, then then it's not the case, right? I hope I answered your questions. Let me know uh, if you have any more questions. True IPD, true IPD means like true IPD means. Let me not connected. Okay. True IPD means like as I said, this is a champion trial. This having a total population of 3,000. This is the closure trial having a total population of 900. So what and the meta-analysis and the conventional meta-analysis, what we are doing is we are just combining the effect size. I mean, like we are combining that, and the systemic embolism occurs in 3 out of this much patient and 1 out of this much patient in this group. And similarly, the other thing, in the true IPD, the trialist, by the trialist I mean the champion AF investigator and the closure AF investigator, what they are doing is they are combining the whole individual patients, one patient by patient, and they're combining it and then doing a meta-analysis. And that's a highly valuable and the evidence of pyramid. Even in meta-analysis, there is a ranking. And the ranking, the lowest is the single arm, but sometimes a single arm is the only thing you have and the only option. Specifically in the vascular surgery and the surgeries, and the surgery you will have a single arm meta-analysis is the only option, right? So single arm meta-analysis, after the conventional meta-analysis, after this Kaplan-Meier reconstructed meta-analysis, and the topmost is the true IPD, individual patient data meta-analysis, right? Yeah. So if you have any more questions, let me know. No question? Hello? Am I audible to you? Okay, so I think I'll end the session, and good luck for your next class. This will be that class will be specifically on making a search strategy for a topic as for the questions. Thank you. Making a pickout for your meta-analysis. Remember one important thing: pickout for a meta-analysis is different from pickout of individual studies. Individual studies, pickout is rigid, right? The, the individual study, the individual study pickout as the individual study pickout as something different. It's rigid. You can't change it because that's already published. But the pickout of your meta-analysis you want, that's on your hand. You can narrow or expand it on your own way as it's look good to you. Yeah, we will have next session. Is anyone of you are speaking? Oh, 1 minute, 1 minute, 1 minute, just 1 minute. Yeah, can you see one more? Sorry, I was not able to hear.
Sir,
Yes, yes.
so as we are the beginners, so the first thing I will ask about that a research question, the first step in it is. So the
Yes.
my question is how to formulate a research question and how to look for a topic. Like
Yes.
we can't like prepare a question or topic from ourselves. You know it very well. So how to look for a topic and all these things, kindly clarify this thing to me.
Okay, thank you, Rohit. The thing is that I will in the next session, I will show you the ways like how you can make the peacock questions of your research topic of the meta-analysis you are interested in. Right. Here in this session, I said like what's the different like what's the condition for meta-analysis. What in the next session, I will say to you how you will formulate your own research questions. But for those questions, we will have certain conditions, certain amount of studies for your meta-analysis and no prior meta-analysis. Right. So yeah, we will discuss it in the next session. I will try to be more Muhammad Khan, how to check the viability of a topic. Uh, did you join the session later? I mean, I explained in this session. The recording will also be available. You can, yeah, I explained how can you check the viability of your meta-analysis and check if this specific topic, the research question you formed on, is it viable or not. Yeah, you can do that. In the next session, we will, as Tuhit said, we will look for how you can formulate your own research questions, how you can make their peacock, how you can make search strategy for it, and the data extraction process. Yeah. How much time will it take to learn R? Okay, R. It will take 3 hours. Yeah, it will take 3 hours of you to do a sample meta-analysis. Yeah, 3 hours. It's easy. And it's highly flexible. Once you know R, that's really worth it. Any more question? Okay, we need to end it because I think no problem.
Asad bhai, I have a lot of questions, but right now it's not a time for that. Actually, I'm a beginner, so that's why I'm so confused. And inshallah, with time, I will be better. That's why I'm skipping now these questions. So,
No problem, Adnan. Adnan, specifically, you are from BDS, so I have the opportunity to do I have done a specific analysis in a dentistry paper. Actually, the person said to me twice and thrice that, Asad, can you please do analysis of our topic? Actually, the topic was on dentistry. I'll share the topic and personal message, by personal message. So I have the opportunity to work in a dentistry group. So yeah, by the time, and then inshallah by the next session we will have a lot of things sort out. Yeah, source of learning are some specific codes I will share with you, and furthermore, if you're learning more, you can use Korean methodology journal, because that's really nice papers. I love it. I love Korean methodology journals, and I like it. Furthermore, you can use ChatGPT to you can just say to ChatGPT, hey ChatGPT, I want to specifically make this first plot, and or can you please give me a specific code, and also let me know what's the meaning of each arguments in this specific code. So help that help a lot.
Asad,
Great.
Asad, last question.
Yes.
असद आप साइड में भी कोई सोर्सेज वगैरह बता दो कि हम खुद भी हासिल करें टू लर्न दिस मेटा एनालिसिस, कोई सोर्स या कोई भी चीज ऐसा हो कि हमारी रिसर्च जो मेटा एनालिसिस स्किल है वो इम्प्रूव हो जाए उससे.
ओके, सही है. Actually, source is a specific regarding a specific thing. If you want, you can ask in the group. In the group we have, if regarding a specific thing you want something, ask question. I and everybody in the group will try to help you.
Okay, that's great. Thank you.
You're welcome. Well, Python expertise. Yeah, obviously, Khazar. Yeah, it helps. It helps a lot. That's not, I mean, same, but it's similar. Can you please go over journal selection briefly at the end? A lot of manuscripts go unpublished, even though the journal themselves praise the methodology used. They just don't think the topic. That's the thing. That's the thing. They just think the topic is not a high priority enough for the journal. That's really an important thing. Do you know what? Do you think, like, if you ask me that, Asad, what's the thing that lead to a high? Like, a simple methodology is not enough. That you are doing great statistic and you will do that. I will submit my paper to JAMA. No, that's not happening. The first thing is your research question. Your research question should be meaningful and should be clinically relevant. Now, you will say that, Asad, how will I know that my research question is good and clinically relevant? I promise that will only happen if you are, if you select, if you dedicate only to a specific field, right? That will only happen. If you today are working in a gastroenterology and the other day you are working in a vascular surgery, that will not happen. Yeah, then your research will not be meaningful and you'll be not enough dedicated, you'll be not enough focused, and you will not have an idea. And a more specific thing is, you need to read a lot of papers. Like, I'm sharing my personal view. Like, from the last 2-3 months, I'm specifically dedicated to specifically aortic root, aortic arch, and similarly endovascular procedures. So now I'm having ideas about this. Now I having idea about this. The thing is that you need to, and specifically screening. When you are doing helping someone in screening process, you should not blindly just go with screening. You should thoughtfully do screening so that you, by this paper, by this way, you will have idea. Recently, I have an idea. I was helping someone else and they're screening. I just came across a specific topic. I searched their viability directly from the screening. I go to the viability, checking the viability of this topic, and this topic are viable. Yeah. So that's the thing. Furthermore, Manahil, I'll say this to you that once you learn a methodology, go to the PhDs in the field, uh, a specific PhD who are doing recently meta-analysis. As I said to you about, yeah, Abdul Basit, ये बातें बताई नहीं जाती. Yeah, that's the thing. That's the thing. It's okay. So the thing is that you need to go to the PhDs who are actively working in their field, and the field, like not in the field, like if they are doing in the original papers, they won't help you. Just like the one today, I share my own experience here. What she said to me, she is now working towards primary observational studies, but at the prior time she have published great paper in vascular surgery. So that's why I email her. So this is the thing, you need to look for the PhDs. You need to work with them in one paper, in 2 or 3 papers in the field you are interested in, and after that you're working in the field, doing the screening, doing the data extraction, everything on your own. You will have an idea. When you are dedicated to a specific topic, you will have idea on that specific topic. But when you are dispersed, no, then it will waste a lot of your energies, and that won't help you. Yeah, that's my experience. Yeah. Because the general priority depends on clinical relevance, uh, and when the individual studies have conflicting results, when one study is saying something else, others saying, and the conclusion is saying something else, they're the high controversial topic, and then your meta-analysis will be really interesting, really useful. And then high impact factor, obviously they must have enough priority for your topic. Any question? Okay, let me stop recording.
So if you can link me with him, it will be great for me. I will work with him.
Okay. Adnan, I will talk to you in person.
Okay, thank you.
No problem.